Hi, welcome to another edition of Ask Dr. George. Today I'm going to be showing you one of the technologies that we have here at my clinic, and it's called a CBCT, or basically it's known as a CAT scan. So let me get into a little bit how we use it and introduce you to the technology. So let's get started. What I'm going to do today is I'm going to introduce you to the CT scanning machines that we use here in dentistry and how we use them and what we use them for. So what we use them for is planning, what I use it for the most is planning for implant surgeries. And most of my implant patients are going to have a CT scan done, and what that allows me to do is it allows me to see a three-dimensional image of the jawbones that we're going to be operating on. And that's really important because in most of the radiographs that we take, all we get is a two-dimensional, very flat image. So I get a two-dimension, I can see the height, I can see the width, but I can't see the depth. And so when we're trying to image certain structures like nerves, sinuses, the width of the bone, we really need that third dimension so that I can see, because oftentimes we may see a jawbone that looks like this right here, and it looks like we have lots of height of bone to be able to put the implants into, but what we cannot see is how wide is that bone in this dimension, do we have enough width to be able to put them in, and where are the structures that are going to cause a problem for me. So what I'm going to do right now is I'm going to start with a raw situation here. I haven't done any imaging, I haven't looked at this yet, and I'm going to show you how we mark out the nerve, how I place the implants virtually, and then how I'm going to use that as my plan for doing the actual surgery, which I'm going to be doing next week. So let's get started. So one of the first images that people like to see, if people have a CT scan done, is they like to see the three-dimensional image. So this is the three-dimensional image of the upper and lower jaws here, and you can see we can rotate that around. I can look at it from the inside and from the outside, and we can get an idea of the size and shape and placement of where all the bone is. So generally this is a view that patients like to see, but it's not a view that we tend to work from in the field. We work from a series of two-dimensional views that give me all of this information so that I can work with it. So if we take a look here, I'm just going to reset the positioning here of the bone. So the very first thing that I want to do is I want to find where the main nerves lie. So, okay, so here we are. I want you to pay attention to this panel right here, and I want you to see this line right here. This line represents, so this is the lower jawbone, and this line here represents basically a hole in that bone. It's significant because that hole is filled with something that's very important, and that is a main nerve that runs through the middle of your jaw. This is the nerve that when we're doing dentistry on the lower teeth, that's the one that we numb up. And so if we were to damage this nerve in surgery, you would be left with a permanent numbing of that lower lip. So obviously that is a very bad thing that we don't want to do. So what we're going to do is mark out where the nerve is before I start planning out all my implants. So what I'm going to do here is mark this out. And then I'm going to work my way back, and I'm going to follow that nerve all the way to the back of the jaw. And keep it well marked out. And then I can use my finders here, and you can sort of see this little black line running all the way up the jaw here, and you can see it in this view as well. So I can mark out the position of the nerve. So let me move this window out of the way here. And now you can see where this person's nerve is running. And this is very interesting because normally that nerve will run quite a bit higher up inside the jawbone. So in this person's case, they have a lot of room above the nerve. This is a very safe case for me to do implant placement on because I've got a lot of height of bone from here to here. So one of the nice things, so this is an actual case, we're going to be removing all the lower teeth next week and we're going to be placing implants here. So typically I'm going to be placing implants in certain teeth positions, and what I'm going to do now is go ahead and place some of those implants on the left hand side. So I want to go underneath the first molar so we can count from the center. This is 2, 3, 4, 5, 6, 7, and that's her wisdom tooth. We're going to be placing implants in the number 6 region. So let me go here. And we can actually place that implant into the jawbone exactly where we want it to be. So here I am. I'm going to place that implant right here. And I want it to actually be inside the jawbone. Now this particular implant, if you look over here, it gives me my implant sizes. I can choose which manufacturer that I want to use. In this case, I'm using a Straumann implant. And this is a very large implant that I'm placing here. In fact, it's one of our bigger implants. It's a 12 millimeter long implant by 5 millimeter diameter. And you can see here that it fits into the width of the jawbone very nicely. This picture here is a cross-sectional view with a cut going right through this area right here, that right across here, that allows me to place that implant. So I'm very far away from the nerve. I'm not worried about hitting the nerve in this case, and I can put a nice big implant into this area. So that's my first implant. Now I'm going to be placing another one in the number 4 position right here. So you can see this is the tooth that's going to be coming out. Here's the jawbone. And I'm going to place another implant. And I can pretty much place the same size implant into that area that I put into the back one. We've got lots and lots and lots of bone here. Now you can see that jawbone's going on an angle, and this is putting my implant in straight. I'm probably going to turn it a little bit and keep it in line with the jawbone a little bit here, just like that. And that way my implant will kind of come out in line with where the old tooth used to be. So that's my second implant. So you can see the first 2 have been placed now. The next one's going to go into the anterior region. And another thing that you can see is you see that this bone is really angling forward. So this is the front of her face. This is where her lips would be out here, and this is where her tongue would be sitting back in here. And so this particular lady's teeth, if we go back to the 3-dimensional view here, you can see that those teeth are really leaning forward. Do you see that? They're really leaning forward, and so are her top teeth. So in our planning, we are going to have to compensate for that. This lady may not want her teeth to look like that when we're all done. She may want me to straighten them out and pull them back in a little bit. And so I'm going to place my implants in such a way that I'll have access to be able to move the teeth either forward or backwards depending on my implant placement. So if I go back in here, let's go ahead and place the front implant now. I'm going to use a slightly smaller size for this one, a little narrower diameter. And you can see if I was putting the implant in straight, that my implant wouldn't even be in the jawbone at all. So the planning software does allow me to tilt the implant and get it into the jawbone, which is what I'm going to do here. And I think I'm going to use a slightly narrower implant. Are you able to pick that up well? So that you can see how that implant is fitting into the jawbone here. So here's my implant, and here's the bone that we're going to be putting it into. And by using this size of implant, I have lots of bone on both sides of where my implant's going to go, and I can visualize exactly its positioning, and then we can go ahead and place that implant. Now, this implant, the top of it would be coming out directly in line with where her teeth are. If we decide that we want to make her teeth more straight like this, then I would be putting an attachment on the top of this implant that's going to get my access opening to come up into this direction here. And so we have specialized attachments that allow us to change the angulation of where the teeth are going to go with respect to the implant. The other thing I can do is straighten the implant up a little bit more, like so, which is probably how I'm going to place that implant. And then I can use my different angulation pieces here to sort of bring that tooth back a little bit. So that's the next implant that's been placed. So we're already at 3 of them. Now I can move forward into the next position here and place another implant. Here we are, and I'm going to do the same thing here. I'm going to tilt that implant a little bit. This person has quite a lot of bone width, which is really nice. Generally, we'll see that the bone width can be much narrower than that, but this person's jaw is quite large and is going to allow me to place my implants exactly where I want them to be, and there's lots and lots of bone for me to do that. So there's various parameters here that I can play with, and we can see the exact positioning of the implants in all positions. So now I'm going to map out the nerve on the right-hand side. Now the one thing you're going to notice on the right-hand side is look how much higher up the nerve is sitting. On the left, the nerve was way down here. On the right, that nerve is sitting up a little bit higher. And we're going to mark that out. Now it does drop after its initial opening. And so we can map that out very nicely here using different views. So you can see now where the nerve sits on the right-hand side. So now I've got 2 more implants to place over here, which I'm going to do right now. Oops, I don't want that. So I want to be, so this is tooth number 3, 4, 5, 6. So I want to be back in this area here. Here's the cross-sectional view again. I'm going to place that implant. And again, this is a nice big implant here that's going to have lots of support for the bridge that she's going to be having. So that's that one. And one more is going to go right here. I can angle that implant exactly where I want it to be now. And my plan is now complete. So now I can see, you can see if we look at this photograph here, or this image here, you can see where all the implants are going to go. And so we'll be removing these teeth, placing all the implants, and then making a temporary bridge to do teeth in a day. So if we go back to the 3-dimensional image here, now you can see where all the implants are going to be and have an idea of their angulations and where they're going to be placed. I'm probably going to straighten this one out a little bit. And that's where the implants are going to be. So my treatment planning is really done quite easily. Let me go back here. And quite quickly. I think I'm going to move this back implant back a little bit. Get it away from that nerve. Perfect. That's it. And now what we'll be able to do, now I know the exact sizes of each and every implant that I'm going to be placing. I can order all my parts. I can order all the correct angulated pieces that I need to do this. And it literally takes me about that long, you just saw it live, to plan out one of these surgeries. But now I've identified exactly where the critical structures are. I can see what size implants I'm going to be placing, and we can find out from the position of the teeth where everything needs to be. I've been doing this a long time, so it's very easy for me to work with these programs and do all the planning. But this is how we use a CT scan in dentistry today to help us plan and execute our implant strategies and implant surgeries for patients. Okay, so this is another case I want to show you. And in the last case, I was showing you how I planned out for a teeth in a day surgery. Now this particular lady here has been missing her teeth for a long time. And in the first case I showed you, that patient had a lot of bone. We could put huge implants in there and we had no problem. You know, we weren't close to the nerve. We had lots of bone width. We had lots of bone height. It's not always that way. And sometimes we need to be able to have a CT scan just to be able to see how much bone is left. So in this particular case here, I've marked out the nerve again, but you can see that these implants are sitting right on top of the nerve. So if I was to click on one of these implants here, and we'll bring it up, I want you to take a look down in here, and you can see, so the jawbone has got lots of height, but the nerve is sitting right in the center of it, okay? And what we have here is we have an 8 millimeter tall implant, a very short implant, and it's going right to the top of the nerve. In the last case that I was showing you a moment ago, I was using, just so you understand, I was using a 12 millimeter long implant. So to put that in perspective, let me change this to a 12 millimeter implant. So to put the same implant that I used in the last case in here, that's the nerve. I would be drilling right through the nerve and extending a couple millimeters below. So obviously what we're going to have to do in this situation is use a very short implant like this. And even using the short implant, I'm still right on the nerve. Now keep in mind that this distance from the bottom of the implant to the top of the nerve is going to be less than a millimeter. So think about how big a millimeter is. It's not very big at all. You know, that's not how big your jawbone is. Your jawbone is going to be much smaller than that. And so the amount of surgical risk that's involved in doing this implant is quite high. So it's going to take somebody with a lot of experience to be able to drill to 8 millimeters, not 8.5, not 9. At 9, we're doing damage to the nerve, which could lead to a paresthesia. So this is a very difficult, challenging situation, and it's one of the reasons why we use a CT scan to be able to give us this information. Without the CT scan, if we're just doing a regular radiograph, we wouldn't have it calibrated for height. It would be very difficult for us to know where the nerve sits and how much room we've got and whether or not we could even do the procedure at all. So this gives you a better idea of how we use the CT scan to keep our patients safe when we're doing surgery. So the implant will fit, just barely. Part of it is going to be exposed. We'll have to graft that when we do the procedure right up in here. But the implant is a nice wide implant, but very short. Let's take a look here at the upper right-hand area, and you're going to see something a little bit different here. So the first thing I want you to see right here, let me expand this so you can see it better. You see this line here? You see this black space here? That black space represents the sinus. This is an air cavity. It's hollow bone. And so when I'm putting in this back implant, you can see how the implant is skirting right along the edge of that sinus right here. In other words, when I'm placing that implant, if I'm a millimeter or more if I move it a millimeter or more backwards, I'm actually going to be drilling into the sinus itself, which would, again, not be a positive thing. It can be done. There's ways of getting around it. but it's not our ideal situation. So on the back side of this implant, I have this sinus that I need to worry about. Now if we go to the cross-sectional view of this implant, I have enough bone width, and at the front side of this implant, the sinus sits up high, but as we move to the back side of it, now you'll see that the implant is actually in the sinus on the back end, right in here. So this is going to be a bit of a tricky operation getting this particular implant in. Let's take a look at the forward implant here, and what I want you to notice now is that the width of the bone, let me move this implant out of the way, the width of the bone is very narrow here. Okay? So again, we have a problem now that we don't have the bone width in this area. So these are some of the things that we can visualize when I have a three-dimensional x-ray, is that I can see that my implant doesn't fit. Now to put this in perspective for you again, what I've done here is place a very narrow implant. We have different diameters of implants that we can place. So the one that I was placing here on the bottom was a 5mm implant in diameter. So let's take a look at that. You can see that the bone here is not even 5mm wide. This implant is wider than the jawbone itself. So a 5mm implant wouldn't fit. So what I've done is I've used the narrowest implant that I can, which is a 3.3mm diameter implant, and it barely fits. You can see that all the threads are exposed on this side. The bone width is very narrow here. And at the top we have a bit of bone, but on the inside the bone is exposed again. So how would I go about putting an implant in here where I have no bone around that implant? That's a problem that we run into all the time. So this is an area that is going to need some bone reconstruction as well as an implant. So again, this is going to be an advanced situation where I'm going to have to build up the bone on the side and expand the bone in the middle to be able to put that implant in. So this is the kind of information that our CT scans allow us to see in advance, that I don't have enough bone or I do have enough bone. So here I've showed you two different cases. The first one had tons and tons of bone, easy case we can put the implants into. This one is very lacking in bone, it's going to need some bone reconstruction, and it's high risk that we could hit the nerve here. So again, this surgery is going to require a little bit more care and a little bit higher risk. So those are the kinds of things that we use our CT scanner for. I hope you found this interesting and informational, and I really appreciate that you spend the time to take a look and see how we do modern dentistry today. So thank you very much.